Hello and welcome. This is Health Promotion Practices Author Interviews, and my name is Arden Castle. Each episode will explore a recently published article and its author. This week, I am joined by Dr. LaNita Wright, author of Pastors' Perceptions of the Black Church's Role in Teen Pregnancy Prevention, which was published in May 2020. This episode is focused on how her paper connects to the larger public health field, which is just one part of a three-part series with Dr. LaNita Wright. Tune in to our other episodes to hear more about her and other authors. So you recently published an article in May of this year in Health Promotion Practice Journal. Very exciting. So you state in your paper that public health practitioners must understand that although the end result to prevent teen pregnancy may be a common goal among stakeholders, the way the result is accomplished is likely not the same. So what can we do with this knowledge and what are our next steps?
The most important thing to know as a public health professional and practitioner is to meet the community where they are. So recognizing the needs, the barriers, the main passions, the main goals of the community members is a very important first step, right? So being able to recognize that first is the most important aspect of any continuous work that we're doing related to teen pregnancy work and really any other topic. Then I would say beyond that, really understanding not only at the surface, the barriers, right? Because I'm mentioning in my paper, I talk specifically about the Black church system in a specific community. So this is not generalizable to everybody's community, right? So you have to really be able to dig deep into those barriers and make sure that as a professional, as a practitioner, that you're really taking the steps to overcome those barriers as best as possible and not just sweeping them under the rug or saying, oh, that's not a barrier, but that's just your perception, but actually working to overcome those barriers so that there can actually be meaningful change and meaningful health promotion efforts that are happening in the community. So absolutely understanding the needs, understanding wants and passions, but also really being a problem solver, knowing how to solve the problems of the community in a way that makes the most sense.
Definitely. I'm hearing a lot about being not only a good listener, but someone who's going to work with the community to help them find the solution that they're looking for and acknowledging the barriers. And you mentioned in one of our previous interviews about the complementary paper looking at parents' perceptions. And in that way, do you have any future goals for your own research and public health in general?
Absolutely. So I started with the pastors, right? So I thought, you start the head of the church and then you try to understand what does the head of the church think first, and then you go from there. And so my next paper focused on parents and asking them about the role of their church and their role in preventing teen pregnancy. And then next I shifted to adolescents. And so I was actually currently conducting focus groups with adolescents when COVID happened. And so I've had to pause that until we figure out everything with COVID, to see if we're going to be able to return to in-person anytime soon or figure out a virtual way to accomplish this. Not sure yet. There's a pin in that study right now. And so I would want to continue to explore some of the other stakeholders within the Black church system. But I also want to point out that by studying the Black church system, I've actually realized that I am interested in other systems as well. So not only specifically the church system and its influence on young people and families, specifically in the Black community, but also neighborhoods, also other community organizations, other systems. So I'm really curious to tap into different areas where I can really understand how different systems are influencing Black communities. So as of now, I'm still working on various research lines, but I would say on one path, focusing still in the Black church and the stakeholders there, but then another path is working on other interrelated systems and how those interrelated systems work together in order to promote, hopefully, health promoting behaviors and then prevent those health harming behaviors.
Your research is really exciting. I think it's a way that I haven't thought about communities and groups of people, because we think about how do we define a community and thinking about all of the systems and structures that are interplaying with them and really interviewing the people in those places, because I think that sometimes we think of them as structures or that these systems aren't necessarily people. And so I think that this is really an exciting way to approach the health of a particular community and looking at all the different aspects that play into it. And looking at the paper that you recently published, if someone wanted to teach your paper or apply your work, what might that look like?
So the type of paper that I wrote is focusing on, of course, the method. So it's a qualitative study. So I focus a lot on, first of all, the background of the Black church system and learning more about teen pregnancy and the Black community and the church system, but then going into qualitative methodology and then actually an application of a qualitative study, right? So for example, if someone were to use this paper in a class setting, they may use it in a qualitative methods class, or they may use it in some sort of methods class where they talk about quantitative and qualitative methods in public health and trying to understand various needs, wants, aspects of the community. So this is an example of a way to be able to explore that. And I would want to reiterate that when you're conducting qualitative research, that it's not meant to be generalizable to every community. It's really meant to scratch the surface to be able to understand a very specific community, but then also to spark other research. So another part of what someone could do if they're trying to understand how can I use this paper is to use this as a launching point so they can read, what has already happened, but then what can they do that's a little different to serve their own communities. So maybe that is another qualitative study, or maybe that's a quantitative study, or maybe they want to study a different aspect within the Black church system or a different system, but really using this paper as a launching point to be able to further explore their own passions.
Excellent. And I think that it definitely does play a big role in understanding this community specifically, because at the end of the paper, you're very clearly saying we need to understand the community's wants, desires, beliefs before entering as a public health professional. For our next question, we've sort of talked about this before, but how has your work within the Black church system been impacted by COVID-19, and any concerns or new action items for the future?
Mm-hmm. Absolutely. So as I mentioned, I was actually currently conducting a study with adolescents in the Black church system and trying to learn. I was really excited about the focus groups that we had already conducted, and the research assistant, undergraduate research assistant working with me. We both were just so excited about what the young people were telling us, but we only made it through 3 before COVID-19. And so we definitely can't publish with just 3 focus groups. So we're going to wait and try to figure out our next steps from here. So COVID has definitely impacted the way that we conduct research. And I think that this is really challenging a lot of us, especially as researchers and of course practitioners as well. How can we be more creative and innovative in our fields? And so I've been thinking a lot about innovation. So am I going to try to conduct some virtual focus groups with adolescents? I don't know if they can pay attention all on Zoom together. I don't know. Am I going to conduct some, one-on-one interviews over the phone or Zoom, or what does that look like? So I'm still navigating that, honestly, to figure out those next steps. And I'm waiting a little bit to see what happens as we shift into 2021 to see what that's going to look like. And then I'll also mention that because of COVID-19, this has truly highlighted even more equity issues and disparity issues in the Black community, especially since we see such a huge impact of COVID-19 in the Black community. And so that has honestly sparked my interest on that as well. So as it relates to COVID-19 and perhaps other emerging public health issues, what sort of systems influence the way people are responding to those emerging health issues? What sort of systems are already in place that are going to help people to either recover or prevent those health issues that may arise in the future? Because COVID-19 is happening now, but who knows what's going to happen later. So now I'm really interested to see, it's almost like a public health response, right? So how do these systems not only prevent, for example, teen pregnancy, but how do they respond when something happens, and how do they influence their congregants? So it's definitely shifted my attention a bit. I'm not shifting completely out of teen pregnancy and completely out of sexual health, but I am really interested to see that response and the influence on the other side of public health issues as well.
Definitely. It sounds like these next steps are relating to how do these communities mobilize when things are happening? Not only how do they prevent certain disparities from occurring, but how are they mobilizing and how are they meeting the needs that are presented by COVID-19 and other potential threats to their health? We've also sort of touched on this as well, but what is next for you? And like you said, maybe not moving fully out of the Black community and sexual health and thinking at other systems. Is there anything specifically that you see in your future?
I do actually. I want to shift more into interdisciplinary work. So, being able to work within multiple disciplines. So, not only in public health, but perhaps in criminology and sociology and psychology and other areas, and being able to be a part of research teams. So, I'm really interested in being a part of a team in order to study these systems because I think the more you really do things together, especially as professionals, the more you can even learn from each other and from the community because the way you ask questions changes, the way that you approach research questions, those change, everything changes when you have a lot of minds coming together in order to study an issue instead of it just being your mind or two people or three people, being a part of teams that are really multidisciplinary, so maybe across very different disciplines, but then even within public health disciplines, how do we work with one another, having an epi person with a health promotion person with an environmental health person? So how could we work together to really influence change? So that's where my mind is right now on doing more of that multidisciplinary work. And I'll just mention, I'm really interested right now in exploring neighborhoods. So I'm thinking about how do neighborhoods influence health and how can we learn more about neighborhoods in a more multidisciplinary way?
That sounds really interesting and very much in the spirit of qualitative methods of thinking about the biases and the assumptions that you as researchers are going to bring to the table. And when you get diverse voices as researchers and you look at diverse communities, there's just so much to learn and so much to think about in that research. So, very exciting. That is all that we have for you today. So, I want to say thank you, Dr. LaNita Wright, for joining us, and thank you all for listening in. And if you'd like to find out more about our guest this week, you can reach her here. And as always, follow us on Twitter, LinkedIn, and Facebook for more author interviews. Thank you.